Starting your CF can be one of the most exhilarating experiences. You've finally got freedom and autonomy to see patients, you can start earning a paycheck, and really experience all of the goodness that this profession provides. On the flip side, starting off on the wrong foot with your supervisor or interdisciplinary team can mistakenly happen. After supervising a few CFs over the year, there's a few expectations that when set up front can make all the difference in having an amazing experience or a disastrous CF experience. So let's dive in. I'm Teresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Number 1, learn how your supervisor likes to communicate. How do they like to send and receive information? And this may not be the same. Depending on your facility, your supervisor may or may not be inside of your building. This will require a lot of communication to make sure that patients are being assessed and treated appropriately, and also to make sure that you feel comfortable with what you're doing. Ask your supervisor up front how they would like to communicate. Do they want to receive phone calls at the office or get texts in the evening? Do they want a weekly email summary or a weekly meeting to give you feedback in person? Knowing these expectations up front can help reduce friction and foster a better working relationship for both of you. I had a CF a few years back that was very quiet and shy. She didn't like talking on the phone and she didn't respond to texts very well. Her mode of communication was incredibly long and detailed emails. I had been buried in emails and honestly just skimmed right over them because I didn't realize it was her and that was how she was trying to communicate with me. She thought I wasn't responsive, so we had to get on the same page and I shifted her over to our EMR private messaging. I was totally fine with receiving very long, detailed written correspondence. I just needed it in the EMR where I would see it instead of drowning in my email. Are you enjoying this video so far? I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about tips for surviving and thriving in your CF? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Make sure to stick around to the end to claim a freebie or two. Number 2, learn your supervisor's communication style. Do they expect you to jump in and attempt something on your own? Or do they want you to communicate any questions up front before diving in? Again, there is no right or wrong answer, but if they're wondering why you are hesitating and not jumping into the fire while you're waiting for further instruction and direction, there's a disconnect here, a miscommunication. On the flip side, if you try to take the initiative to jump into something, but your supervisor likes to talk things through first, give them the respect to do that. Eventually, you can have a conversation and you say you would like some more autonomy, but allow that trust to build first. I was working closely with an SLP who was supervising a CF. She kept getting extremely frustrated with her because the CF kept going rogue and starting new projects or consulting on patients that didn't follow the facility's specific protocols. The supervisor ended up having a conversation with her and said she loved her drive and initiative, but they really needed to discuss some matters ahead of time because they weren't complying with the facility's procedures. The CF said that she learned in her clinical placements in grad school to always be outgoing and take the initiative first on everything to show that she was invested and eager to learn, when in fact that was not the approach the supervisor wanted her to take. On the flip side, I had a CF that was hesitant to take any initiative. When I finally approached her about it, she mentioned to me that she thought she needed permission for everything, and since I didn't suggest things, she thought they were off limits. We had a great conversation about what procedures should be discussed ahead of time and what ones she has her own autonomy to dive into. A little communication and clarification upfront can make all the difference. Number 3, talk with your supervisor about diving into a big project during your CF. Learning the ins and outs of how facilities operate, their policies and procedures, the chain of command, the managers and corporate leaders, payer sources, risk management, etc. are all vital pieces to understanding how to work successfully within the healthcare ecosystem. There may be many procedures that you just don't quite understand why they are the way they are, or they're extremely outdated and no one got around to changing the policy. But by diving into a big project during your CF, you will inadvertently gain experience with all of these topics and learn why things are the way they are in your facility. Say, for example, you want to create an oral care program in your facility. You would need to communicate with risk management, possibly infection control, maybe even patient safety and quality, depending on what outcomes your facility likes to measure. You'll get to attend meetings with all of these colleagues and really understand their role within the facility. By undertaking a major project, you will learn many skills that can help you exponentially in the long run. Your supervisor will also be there to help guide the way and steer you in the right direction. Earlier in my career, I did not have students or CFs work on projects because I thought they were already overwhelmed and busy enough. I later changed my perspective that this in fact was the perfect opportunity because they have the support to understand the dynamic, and there's no better time to understand how the ecosystem operates than really early on in your career. By showing your supervisor and other team members in your facility that you're able to collaborate and effectively communicate your role on a committee, you will earn the respect and hopefully a seat at the next table. By the way, I've got a free gift for you over at teresarichard.com/advocacy. You'll get instant access to a 60-page playbook that I created to help you advocate for yourself and any new training or program you want to pursue in your organization. Inside, we talk even more in depth about identifying the key players to help you accomplish your goals. Head over to teresarichard.com/advocacy or DM the word advocacy to me on Instagram at TeresaRichardSLP to get your hands on the playbook. The link will be in the description below.